Welcome back, everybody. Oscar Health, the technology-focused health insurance company, is getting a big nod of approval from investors following the company's recent corporate restructuring. The stock is actually up over 70% in the last 6 months since CEO Mark Bertolini announced his plans to bring the company onto the path of profitability. You can take a look at it right there. Over the 6 months, it's up by 67%. Joining us right now is the CEO of Oscar Health, Mark Bertolini. And Mark, welcome.
Thanks. Hi, Becky.
Hi. So this is a company that went public back in March. You joined in April right after.
Right.
It's been a really impressive run since the IPO. What's going on? What are you talking about? Where things stand right now?
Yeah, I think it's really first and foremost about getting to profitability and building the cash flow and capital we need to grow. And so in 2023, we took a step back, slowed the business down a bit, and decided to focus on profitability. So getting the technology right, getting the operating model right, getting the team right. And so that's been our work. And in the first 2 quarters of the year, we've been total company profitability for the first time in the company's history.
Is that the path you're going to stay on, or do you have to get back to growth at some point in investing?
We will be getting back to growth. So our projection is for January's to grow faster or at the market for the ACA, which is about 15 to 20%.
Is this your kind of proof to investors, though? We can do this if we need to. We can change these, make these adjustments, and turn a profit anytime if need be?
Well, given where we've come from, quite frankly, it's kind of pretty straightforward on how to grow and improve margins. So we did a lot in the cost infrastructure of the company, particularly on the operating side. Mario and team have been building large language models that have automated large pieces of the back of our business for some time. So we've been working on this before AI was the cool thing to talk about.
And where do you stand right now? First of all, what specifically did you do to improve margins?
So first, we renegotiated a number of big provider contracts, including our latest PBM update. So the company had not renegotiated the deal for 4 years. I suggested we move forward and get that done. We got a large piece of savings over the next 4 years that will then push through the costs of the company and ultimately be able to generate margin out of it.
Was this just you came in as somebody who'd been running Aetna, who knew the industry so well, knew how this worked, came into what was kind of a technology company and just said, here's the operating basics, here's how you put things together?
Here's how you do this, right?
What a concept.
Right, and it's been great. I mean, the team has been working hard on it. Even when I was an advisor before I became on as CEO, we're working on operating models, staffing models. How many people should we have? How do we focus the technology on things that really matter, like the member experience? Our NPS is 57, where the industry's at 0. So there's a lot of really good opportunity in the platform. Now the platform's set with operating leverage to allow us to grow in the first quarter of next year in a sizable way. We're talking about 20% around that, a little less on membership, a little more on revenue. And we've been able to price through in margin that we otherwise didn't have in the past because of the cost changes we made, both operationally and on the medical side.
So AI is a great buzzword. It's something everybody's working at. If you guys have been working on this for years, what does AI do for you, and how does that compare to what somebody like an Aetna would have?
So our strength is, quite frankly, that we have a single-threaded platform with one version of the truth of data all along the way. So there aren't multiple Mark Bertolinis, for example, in the system. There aren't multiple providers of the same name in the system.
So you don't have old legacy networks you're trying to bring together and make everything work and
all
talk.
the database is single-threaded. The platform is. So the use of large language models, particularly on the back end of the business, translating Chaucerian explanation of benefits into actual English, reduces phone call volume and follow-up and confusion, improves member satisfaction. So we're in the process of implementing 47 different large language models that we've developed over the last 6 months.
I remember when you were at Aetna, you did all kinds of things that really probably helped from the consumer's perspective, but saved you guys costs too. I remember you would do things like send out nurses when somebody came home from a hospital, especially an elderly person, to make sure that they didn't have drugs they were going to trip on. You were trying to make sure that people could get home faster, which most people want to do, but do it with nursing care or something else rather than stay in a hospital. Good for them, good for you because it was cheaper. Are you doing the same things here?
Same thing here. Interestingly enough, our most profitable benefit plan in the ACA is a plan that attracts and treats diabetics. And we believe we can prove that out and make an individual market and make the market more individualized going forward. So there are 35 million people in middle market and small group fully insured employers. we think that should be an individual market.
So how many members does Oscar have right now? How many customers?
Just under 1 million.
That's pretty small at this point.
Yeah, in this game, yes, it is.
What are your goals just for membership? How have you been in terms of retaining and bringing in new members?
So our retention's strong because of our NPS. People like us. Our relationships with the brokers are strong, which helps us keep the business inside the operation. But also it's about expanding markets. So we're moving into markets that are adjacent to the markets we're in by leveraging our provider relationships and looking for good areas where we can get good rates to support people.
Let's talk about what you think in terms of healthcare policy at this point. First up, the negotiation between the government and pharmaceutical companies over some of their priciest drugs that are out there. Is this a good thing, a bad thing?
Good thing. I think it's been a long time coming. I think the PBMs are going to be in trouble. You saw what happened in California with Blue Cross Blue Shield.
The pharmacy benefits managers.
Yep, and the pharmacy benefit managers have had a model that a lot of people have been deconstructing for a number of years. It's been probably a decade where people have been taking that model on, and it's not a surprise now that you have organizations like Blue Cross. Paul Markovich out in California, he's done a really interesting thing. He's decomposed it into vendors for each of the pieces of the PBM business to get the best cost structure. Now, if you can make it all work together, he's actually going to have a different model.
If the PBMs are the problem, why not go after them instead of the pharmaceutical companies?
Well, I think there's plenty of room on both sides on how drugs are priced, how long they're able to price at the high volumes, our costs versus other countries. So I would argue there's room in both places, but middlemen generally generate margins at the cost of consumerism.
I mean, people will say it's the insurance company's faults too, because you guys negotiate much lower rates, and that has to be made up for by the uninsured paying higher rates.
You're talking about the cost shift, and so in large commercial employers, they're paying about 140, 150% of cost because Medicaid pays 65% of cost. Medicare pays 85% of cost, assuming we believe the cost structure is appropriate in the industry, which I'm not quite there.
I think this is a much longer conversation. I hope you'll come back because it's pretty complicated. There's a complicated system we're taking on, but I'd love to have more time to talk it over with you, Mark. Thanks for coming in. Mark Bertolini.
Take care.